Welcome to the Codecast podcast. Real-world insights for your daily medical coding and billing processes. And now, here's your host, Terry Fletcher.
Hello, everyone, and welcome to the Codecast podcast. My name is Terry Fletcher. I hope everyone is surviving the heat now that we are well into August. Today, I think it was 102 degrees. But we're cooling down to a nice, balmy 92 this week. So hopefully you're surviving it wherever you are. Today is the 148th episode of the Codecast podcast, and we're going to talk about something that was just published actually about a week and a half ago by Medicare, and I've had a lot of questions. I also covered the topic on last week's Talk 10 Tuesday with ICD-10 Monitor. But remember, when I'm on Talk 10 Tuesday, I'm only given 4 minutes. And for those of you that know me, 4 minutes is really hard to come together with anything. I do have an article on this topic, and it is on the ICD10monitor.com. And what it is the COVID counseling capture, where you can now bill for talking to patients who come in for testing. And if you have that brief conversation with them regarding how to wear a mask, what is to expect, maybe they need to self-isolate until they know their test result, then that's what you now get paid for. But I wanted to clarify, because this was pushed out like everything else without much direction, and I want you to have direction, otherwise you'll get in trouble when it comes to audits and oversight. And also some of the questions I'm getting were from people saying, so what is the extra code? So I can bill 2 office visits in one day? No. So let's talk about what that is. But first, the Codecast podcast is also brought to you today by Charles Schwab. Be a more informed investor. Follow us for news and insights to help you own your tomorrow. AboutSchwab.com. Okay, so here we are when we're talking about the COVID counseling. And what is that exactly? Okay, so CMS will now allow the reporting of an office visit code, and it's not telehealth, so it's in person. And they say reimburse providers who are eligible, so that would mean your physicians, so MD and DO. That would mean your nurse practitioners and PAs and clinical nurse specialists, because they can bill directly to Medicare. And this is the most important aspect of the counseling. It says at the time of testing, no matter where the test is administered, whether it's at the doctor's office, the urgent care clinic, the hospital, the community drive-through, or pharmacy testing site. So again, eligible providers, MD, DO, NPs, PAs, CNSs. Now, I'm not clear if a pharmacist is an eligible provider, but just so you know now, pharmacists can't bill an E&M service, either under Part D or under Part B. And so I will assume that if there's a physician partnering with a pharmacy and they're the ones who are there, then they're permitted to report the counseling service if performed in the capacity where the physician, or again, a mid-level provider, were actually at the pharmacy partnering with them. If you have RNs or MAs providing testing and also the counseling without the presence of a physician or a mid-level, then I would not bill for it. It's not a billable service. The reason is because most of the ancillary staff who are providing this service, they are basically taking nasal swabs or saying spit in a cup, and then they'll tell somebody you'll get a text of a positive or negative within the hour, and that's not counseling. When I went with my daughter to get tested, that's exactly what they did. She waited in her car. She had to give a description of what her car was. The medical assistant came out to the car, took a nasal swab, which she was like, ouch, that really hurts. I don't know if you've had it tested. I have. I am the antibodies, but it hurts. It is not fun. And she said, okay, we got it. We'll get you back to you within an hour. You'll get a text of positive or negative. And that was it. What the provider counseling payments are for is to encourage approved clinicians to take the time and opportunity to discuss with patients at the time of their testing the immediate need to self-isolate even before their test results are available. Now, I would assume those are patients that have some symptoms. Now, I know that sometimes they're saying even if they are asymptomatic, but that's going to be up to your physician. In addition, if a patient tests positive, the CDC instructs that the patient be told to wear a mask at all times, how to wear the mask, and told they will be contacted by the public health authority and asked to provide information for contact tracing and to tell their immediate household and recent contacts in case it is appropriate for these individuals to also get tested and possibly self-isolate. So what the point of this is to stop the spread of COVID. Now, keep in mind that everyone reacts differently to stressful situations as you think about adding this COVID counseling to your charge capture. So this is why. How a patient responds to stress during COVID pandemic can depend on their background, their social support system from friends or family, their financial situation, their health and emotional background, and all kinds of different factors. And so when you're talking about trying to bill for this, be sensitive to those factors, especially if you're testing a patient that's not established to your practice. So if you give them an instruction that may not be plausible for their situation, that could add some stress. And again, they may do something that isn't appropriate should they test positive. Now, counseling is not just reading from a pamphlet or reading from the CDC website or giving orders to a patient at the time of COVID testing. It's a conversation with the patient. It has to be documented. And it's how to stop the spread and to deal with outside circumstances that could compromise their ability to comply with your directions. And so CMS provided a checklist, and you want to take a look. Again, look at my ICD-10.com, ICD-10monitor.com article that I just posted last week, and you'll see the checklist on there, and it'll give you more instructions. But basically, it says for these visits, it says, first, discuss the need for immediate isolation, even if before the test results are available. Number 2 would be to advise patients to inform their immediate household contacts that they may wish to be tested and quarantined as well. Review locations and people they've been in contact with in the past 2 weeks. Review the signs and symptoms of COVID with the patient. Inform patients that if they're positive, again, they'll likely be contacted by a public health worker to let them know what they need to do. So encourage them to answer the call even if they don't know who the call is from, and then discuss services that might help the patient isolate and quarantine at home if they are positive. And so it's unfortunate that it sounds almost like a scare tactic. That's not what it is. It's really saying that we want you to do more than just take a swab, and we really want it to be a practitioner who knows what they're talking about. Now, you may be, surrounded by medical assistants that feel that they've got the spiel handled, but that's not who can bill directly to the payer. Also, what I would recommend is that you time these visits along with the documentation of the counseling checklist, and make a checklist. I absolutely would, and check it off that you actually talk to the patient. The reason is that these counseling visits and these conversations are quick. So if you spent, let's say, 15 minutes for a new patient, then you are looking at possibly 99201, because it's Medicare, you can't round up, and 99202 is 20 minutes. If it was an established patient visit, and it was 10 minutes, and that would be a 99212, or if it was 15 minutes, it would be a 99213. Now, here's the thing that you have to be careful of. Be honest and truthful and realistic. I saw somebody saying, well, okay, so these are level 5s. I'm like, where are you getting a level 5 from? That is 40 minutes. And if you have a patient waiting in a drive-through and you really think somebody's going to buy that you're going to stand there and talk to them for 40 minutes in a drive-through lane, I think that there's a possibility you may have one patient that may have that where you do take the time, but it's not going to be the norm. And so I would really look at this as a patient who has just a quick visit after they come in for testing. Now, I also want to be clear on one thing, and this is where I'm getting a lot of the questions to clarify. This is for a patient, okay, either new or established, that is only at your point of contact. And I say that because wherever your testing site is at, if you're testing, whether it be your office, pharmacy, urgent care, wherever, it's only for the patient coming in for testing. After the test, then there's that brief counseling conversation on the checklist about self-isolation, quarantine, and then all the CDC rules. It's not for a patient that has a scheduled E&M service for their chronic conditions you're managing, or for a new problem. Let's say patients coming in because they want to establish care for cardiovascular disease, and they say while they're there, can they get a COVID test? Well, they can, but there's no extra charge for the added discussion of the counseling for COVID. That would just be part of that assessment and plan for that already planned new or established patient visit. So again, these are patients that are just coming in for a COVID test, just in the drive-through center, waiting out in their car, or, if you have them come in, however you do it, and you're having that brief conversation with them. So make sure that you know the difference, that it's not an extra or a separate office visit that day. It's just something that they're adding to the testing, because right now, or I should say before July 28th, they only allowed the testing only. And so now they're saying a brief conversation can also be billed as counseling. So just make sure you follow the checklist, you put time in your note, and that it's an appropriate provider that is dealing with the counseling. And that I would probably use place of service 11 as office if you're in a drive-thru or if you're in your office. Even if you're using a makeshift office such as the pharmacy or something like that. Now, if you're in a hospital, you have to use the hospital outpatient if you're doing it there, or if you're in a different place of service. So know the difference there. And somebody said, well, can we also do a second visit as a telehealth visit? Not if it's just about COVID counseling. They said no. It's only at the time of the test. So later on, if there's going to be, a telehealth visit, and it's not just a phone call because there's globals on those, then that's a possibility if it's not just about that, unless they get sick and now you have to deal with a sick patient. But the reason that this was such a big deal is because they gave us, Medicare gave us an okay to bill for a service that really is for preventative, and we're billing it as a problem-oriented visit. And so that's why you want to make sure that not only have you coded it correctly, you use the appropriate diagnosis. If the patient's getting tested, do they have sign or symptoms? What is that? Because then that would be the CS modifier, so they don't have an out-of-pocket. But if they're not having any kind of symptomatology when they do that, I know that where we got my daughters, for example, this was a drive-through clinic, and they charged us $100 cash. There was really no conversation. There was nothing after that. And, so obviously this is for Medicare patients only. I'm not seeing any other payer do this right now. And it's really just if you have that conversation. So keep that in mind. CMS, I felt, hit the mark here. This is a good thing, but just make sure that you're compliant, you're adhering to the rules, and don't overutilize this or take advantage of the situation. That's not going to help anybody. Okay, so let's look at our coding question today. And this one actually talks about modifiers for laboratory services. So I've had a couple of questions on my Coding Corner site from people saying, can you just go over a couple of the modifiers for labs? So there are 3 laboratory modifiers that you could run across in your daily coding. One is the QW, that's called a CLIA wave test. There's the 90 modifier, and that is for the reference outside laboratory. And the 91 modifier, repeat clinical diagnostic laboratory test. So the QW modifier, this is used to indicate that the diagnostic lab service is CLIA waived. That means Clinical Laboratory Improvement Amendment, so CLIA waived, and that the provider has a certificate of the waiver. So it means you're allowed to provide that actual lab test in your office. So the provider must be a certificate holder in order to legally perform clinical laboratory testing. And Medicare publishes a list of waived tests quarterly, and it indicates which tests must be accompanied by the QW modifier, so which one have to be CLIA waived. So make sure when you go to cms.gov, you also want to type in CLIA downloads, and it'll tell you which ones are there. The modifier 90, this is reported when a laboratory test was performed by a party other than the treating or reporting physician or other qualified healthcare professional. So some payers require direct billing by the lab, other than the physician's office billing on behalf of the lab, and that's what this is. So look at your payer rules. The modifier 90 may also be used when one laboratory references out a test to another laboratory, but that gets a little tricky, so make sure that you're always checking coverages first. And then modifier 91, that is reported when a diagnostic test has been repeated on the same date of service because the physician needs comparative results. So it's never used for a repeat lab procedure due to an inadequate sample, quality control, or confirmed results. It's basically you need comparative results, so your diagnoses should be appropriate there when it comes to that. So just want to make sure you have that information. I know some of you do code for labs, and I don't really talk about that very often. Our coding question was brought to you today by Ozark Medical Coding. Join us for the Advanced Cardiology virtual summit September 11th and 12th, all on demand with Q&A opportunities both days at the end. And actually, it's a Zoom call with me and 3 other speakers. Go to cardiologysummit2020.com/register. So we're doing everything from cath lab to interventions to EP. I'm actually also going to be doing EVARs and TAVRs, so valve replacements and endovascular repairs. I'm going to do a collection and appeals for cardio. So it's a pretty big summit. There's going to be ICD-10, ICD-10 PCS. But just know that it's a weekend. They're all available on demand. And then also we'll be on live for Q&A at the end of both sessions. So they are sponsoring today. So hopefully we'll get some of you to join that. So again, cardiologysummit2020.com/register. So my personal tidbit today, you kind of heard about it a little bit earlier. And yes, Summer did get her job as a 7th and 8th grade English teacher, and she's moving to Phoenix, Arizona. So you know what? I'm having a little bit of a pity party here, but I'm a proud mom. This is what we get our kids ready for, to basically fly out of the nest, and it's time. So she got her dream job. She's very excited and excited for the future. She's so excited just to have her own apartment, her own life, her own job, even though she's like, I'll miss you. I can just tell she can't even wait to get there. On another note, I hope with sports back, everyone has been enjoying golf and hockey playoffs and baseball. I'm really excited about the Indians this season, but they basically go up and down. Yes, I'm a Cleveland Indian fan. That's Summer's fault. Used to be Pittsburgh Pirates. I'm kind of a Dodger fan still, since they finally got back on TV after 6 years of not being on TV because of squabbling with DirecTV. But that's been pretty good to have the distraction. And NFL is less than a month away. So let's see if they can get fans in the stands. I have a feeling it may not happen, but we hope it does. Also, I started writing again for SteelCityUnderground.com, which is the Steelers site, and also start podcasting the WTF What the Football podcast for them soon as we get into the regular season. So I hope everybody listens to that. So everyone, make it a great Tuesday. Thanks for listening today, and make it a great day. And thank you for listening again to the Codecast podcast.
For more information on medical coding, billing, auditing, and compliance, including how to hire Terry, follow Terry on Twitter @TerryCoder1 or visit her website at www.terryfletcher.net. Podcast producer Joe Kuzma. Music producer Dassassin Music.